Maine's Medicaid program faced yet another shortfall. A shortfall that would ultimately be closed by cutting funding for other important state agencies and priorities, and of course adding to Maine's tax burden. The Medicaid program had been on an unsustainable path. Governor LePage, from the very beginning, set his sights on stabilizing the financial foundation of the Department of Health and Human Services to ensure that we could align our limited resources with core priorities. Previous shortfalls that drove the program had grown beyond the state's ability to fund. For more than a decade, this growth in the program was paid for by failing to pay bills on time, accumulating massive hospital debt, and cutting provider reimbursement rates, and certainly failing to keep pace with the costs of delivering care, and worse, neglecting the core priorities of our elderly, disabled, and individuals with mental illness. You simply cannot appropriately manage or prioritize if you are annually dealing with massive shortfalls and a financial crisis year after year. Such has been the case for decades at DHHS. But this year, however, we come with very good news. Because of the governor's leadership, because of the difficult decisions that have been made, we are pleased to report that this year, Medicaid spending has been brought under control, and we face no significant shortfall in our Medicaid program. We have worked hard for the last 4 years with Governor LePage's vision and leadership to stabilize the financial foundation in this agency and to make decisions to move us away from bailing out the vote to effectively charting a course for the people of Maine that best reflects the core priorities of serving our most vulnerable citizens. This year, we will not be asking other state agencies to sacrifice resources from our schools, roads, environment, and economic development priorities just so we can plug a massive hole in the Department of Health and Human Services budget. Indeed, part of the motivation for getting DHHS spending under control was to facilitate a lower state income tax, to grow Maine's economy, and provide opportunities for the people of Maine so that they don't have to depend on poverty-based programs in the Department of Health and Human Services. There is no more transformative opportunity for a hand up than a good-paying job. In sum, Governor LePage's budget for DHHS identifies approximately $106 million in savings to pay for $112 million in spending that aligns the mission of the Medicaid program to best support our individuals with intellectual and developmental disabilities, physical disabilities, brain injuries, our elderly, and to invest in primary care. The governor's budget reflects the benefits of stabilizing Medicaid spending, concentrating the program's resources on Maine's neediest and most vulnerable, and investing in innovative new ways to control costs and improve care by rewarding quality instead of volume. As you know, the Medicaid program over the last decade doubled in size, growing from $1.2 billion in 2002 to $2.4 billion. Over that time, as I've indicated, bills were not getting paid, provider reimbursement rates were getting slashed, and we were not addressing many of the gaps in services that so many in our state need and deserve. I want to highlight for you a number of the critical initiatives that we are proposing in this budget. Our wait lists for people with intellectual and developmental disabilities and physical disabilities. We are proposing the most aggressive effort yet to provide services to those currently on our wait lists who need services. This budget proposes 40 million over the biennium to provide services for those who are in need of services and supports in their home. I want to just quickly give you an example of who we are talking about. We are talking about families, 75-year-old couple with a 50-year-old son, adult son with Down syndrome. The elderly couple's health is failing, and they are struggling to figure out a way to care for their son. They need services and supports in their home, or their son needs to be in a residential program, and their son has been on a wait list. And there are many, many families throughout the state who are in that situation, and this budget seeks to once and for all make those families a priority. We also know that there are a number of children today who are being diagnosed with autism, and as they graduate from school, having benefited from a robust system of services, they are going on adult wait lists and are not able to maintain and receive the services in their homes and in their communities. We are funding those needs. This has been the governor's chief concern and certainly the priorities that he has laid out. Moreover, families across the state and across this country, we all are dealing with aging parents, grandparents, aunts, uncles, brothers, sisters who want to stay in their homes, want to be able to stay there as long as they can. And we are prioritizing services and supports that will allow our seniors to stay home longer and reduce and delay the need for costlier 24/7 facility-based services. Another focus of this budget pertains to our struggling nursing homes. We've seen it time and time again in the news that rural nursing homes closing, and in part because of Medicaid reimbursement rates. We can no longer shortchange the nursing homes that care for our elderly loved ones and provide good jobs in struggling communities. Although legislation was passed last year and we were able to find funding for nursing homes, it was one-time funding. We needed in this budget to provide permanent funding to sustain these increased reimbursement rates for nursing facilities. This budget provides that ongoing source of funding, allocating $24 million in state funds over the biennium to support nursing facilities. This figure also includes a $2.2 million initiative to address remote access facilities through a 100% state-funded grant program. Another significant investment in this program pertains to primary care physicians and an investment in the new model of care known as health homes. You may be aware that Maine, like many states, benefited under the Affordable Care Act with increased federal reimbursement, 100% federal reimbursement to bring primary care physician reimbursement rates up from Medicaid rates to the Medicare rate of reimbursement. Unfortunately, that was temporary funding from the federal government. It was a 2-year commitment. It expired on December 31st, 2014. The governor has long said and has impressed upon me the importance of investing in primary care so that we can provide good and effective care management, chronic disease management in the primary care practices to produce better outcomes and to reduce costlier use of the system, emergency departments, preventable admissions and readmissions to the hospitals. We are proposing to continue with that higher rate of reimbursement for primary care physicians and replacing that lost federal funds with state dollars. Additionally, we are maintaining the commitment to health homes. Health homes, as I said, is a new and innovative model to support care management and a team-based approach in the primary care setting. It benefited from temporary 90-10 match from the federal government. Again, that was to expire 2 years from the establishment of the health homes in the state. Maine will begin to expire in January. We are proposing to maintain our commitment to this model of primary care and replacing those lost federal dollars. As you all know, coverage is meaningless. Providing someone a card is meaningless if they don't have access to care. And for too long, because of the poor rates of reimbursement to primary care physicians, physicians have either closed their practice to Medicaid patients or have greatly limited the number of Medicaid patients they care for. We are focused on reversing that trend and supporting improved access. I also want to highlight the increased commitment to mental health services and funding. I know that Governor LePage is particularly proud of the initiative in this budget to fully meet conditions of the consent decree for Mainers who suffer from mental illness by providing $11.6 million in funding to fulfill unmet needs, in addition to $1.5 million in increased funding for the Bridging Rental Assistance Program to help the mentally ill find the needed community-based services and housing supports. Taking care of Mainers suffering from severe mental illness also means ensuring that Riverview Psychiatric Recovery Center is truly a center of excellence for the treatment and care of Maine's most psychiatrically challenged citizens. We have a number of initiatives that continue to build upon some of the work that has already been endorsed and approved in recent legislatures to support enhanced staffing model, to focus on our patient-centered delivery of care, and to ensure a high-quality environment and safe environment for our patients and our staff. As part of our commitment to fund all of these important initiatives, without imposing additional burden on taxpayers or eating into the budgets of other state agencies, we have identified several common-sense ways to reduce spending. One is a much-needed reform to general assistance reimbursement to municipalities. For years, under the current system, state taxpayers provided 50% of GA costs to municipalities up to a certain threshold. Beyond that, the state, for a handful of towns, 3 in particular, Portland, Bangor, and Lewiston, they received a 90-10 match to cover the cost of GA. This has created a perverse incentive for large municipalities to accelerate spending under GA in order to trigger that 90-10 match. We are proposing in this budget to flip the GA funding formula, providing a larger 90% match up front to all municipalities, so that we can ensure greater support throughout the state and eliminate this perverse incentive. We are also looking at a number of payment reform initiatives. One in particular, if you arrive at the emergency department for a non-emergent matter, we are going to reimburse the hospital at a primary care rate. We are also proposing parity in the reimbursement for physicians between private physicians and hospital-based physicians. For years, hospital-based physicians have received an enhanced reimbursement rate, and we are eliminating that in this budget. In conclusion, this budget is unlike any other DHHS has helped to craft, not only for the initiatives it puts forward, but for the simple fact that these initiatives are finally possible. Maine's Medicaid program and DHHS as a whole are no longer in the perpetual state of financial crisis which has plagued this department for decades. No longer are we swimming in a sea of red ink while seniors lose their nursing home beds and disabled Mainers languish on wait lists with no end in sight. Funding our nursing homes, wait lists, and primary care initiatives are the culmination of our efforts, the governor's leadership, to contain program costs and to ensure that we are finally able to align our limited resources with this state's core priorities and to create fiscal accountability and stability within the Maine Department of Health and Human Services. Thank you.